systematic shows your dedication. We are honored to have with us Dr. Venkatesh Babu, sir, the teaching faculty in the College of Dental Medicine from the University of Sharjah, UAE, who will guide us on how to improve the quality of systematic reviews before submitting for publication. We are glad to welcome Dr. M. Rajashekaran, sir, who is the professor of Department of Conservative Dentistry and Endodontics from Raga's Dental College and Hospital. He completed his undergraduation and post-graduation from Raga's Dental College. He has 17 years of teaching experience for the postgraduate and undergraduate students. He has 20 publications in national and international journals. He has won several awards and presented several scientific papers at national and international forums. To his credits, he has held the position of the organizing secretary, scientific chairman, and the joint organizing secretary for the ISDR, FODI, IACDE PG Convention, and IFIA Conference. He presently holds the prestigious position of the honorary secretary of Conservative Dentistry and Endodontic Association of Tamil Nadu. He was formerly the vice president and executive committee member of IACDE. Over to you, sir.
Good morning. Am I audible, ma'am?
Yes, sir.
Thank you. Thanks for the nice introduction. I thank Dr. Mahalakshmi Madam, Dr. Rajkumar, and the entire SRM team for giving this opportunity. And I'm very happy to be moderator for this session, especially when Dr. Babu is presenting. He's one of my good friends. So he's going to talk about how to improvise the quality of systematic review for a publication. Basically, systematic review aims to retrieve, synthesize, and appraise the existing knowledge on a particular subject. The value and the credibility of a systematic review depends on the importance of the question, the quality of original studies, the efforts of undertaken to minimize bias and clinical applicability. Not all systematic reviews are of high quality, and it's important to critically assess their validity and applicability. Today, Dr. Babu is going to give an insight into how to write a good systematic review. He's, I feel he's the king in that subject. So we'll hear from him. Before going into that, I'll just read about the short CV. It's a very long CV, but we have condensed for the time's sake. Dr. Venkatesh Babu is currently a teaching faculty in the College of Dental Medicine, University of Sharjah, UAE. He completed his BDS from Raja Muthiah Dental College and MDS from Meenakshi Ammal Dental College. And also he pursued his PhD from Sri Ramchandra Dental University and Research Institute. He is a well-known researcher and has won several awards and research grants to his credits. He has published more than 95 articles in indexed reputed journals. He has published more than, he currently serves as associate editor with a specific responsibility for systemic reviews in our specialty journal, International Endodontic Journal. So Dr. Babu, over to you. We would like to hear from you. Thank you.
Thank you for your kind words, sir. And I wish you a wonderful birthday. Happy birthday for you, sir.
Thanks. Thank you, Babu.
Hope you got blessings from most of your relatives.
Mahalakshmi Madam has given me a good gift, sitting for a systemic review on the day of birthday. Thank you.
Can you see my slides, right, sir?
Yeah, we can see.
Yes, yes.
Please go ahead.
So today my topic will be how to improve the quality of systematic reviews before submitting for publication. So for this past 1.5 days, I think three speakers have extremely explained about how to conduct the systematic review. For example, Nivedita ma'am showed you how to perform your systematic review. For example, literature search process, So she explained you how to perform the literature search, how to create your research question, and well sir explained what are all the tools available for risk of bias and how to perform the risk of bias assessment. And Dr. Srini explained you exhaustively about the statistical analysis, especially about meta-analysis, your publication bias and everything. So Today, my objective will be explaining you to say how to improve the overall quality of systematic reviews. As very well said by Rajshekhar sir, all published systematic review is not of high quality, even though if it's after published. So my aim, I'll be explaining you to you how to write in a manuscript, how to report in the while we are sending it for publication. So I will be dealing with mainly about these parts. What is the need for systematic review? What do you mean by quality? Whether the topic is suitable systematic review or narrative review, it means how to select the topic for systematic review, and what are the points to be highlighted and importance of protocol, and how you have to write your title, abstract, introduction, methods, results, discussion, and conclusion. So my presentation, I'll be dealing it in three different angles. One is as an author, I wrote few papers, and most of the papers sometimes it got rejected. So that experience, plus as a reviewer, I used to review few papers. So what is the experience which I gained? And lastly, about being an associate editor for one of the journal, I quite often review a lot of papers, and what is expected from them, I will be highlighting in this presentation. So coming to the first content is, why do we need systematic reviews? So everybody, the three speakers showed what is the importance of systematic review based on its hierarchies, more important, so better than your clinical studies. So for example, what is to show you what is the importance of systematic review. If you see this particular paper, it's an extremely good, hats off to a periodontist. So what they did is, they published one particular issue in 2020 for what are all the treatment and clinical practice guidelines for various treatment modalities in perio. So it means this is the issue content. If you see that, the first paper is treatment of stage 1 and 3D periodontitis. Based how they got this first paper is based on this following 15 systematic review. So they developed 15 research questions, depends on the different treatment plan. So they have combined the results of all the systematic reviews and released this particular paper, saying that, so most of the, if you read this particular paper, you can get about the whole creative holistic approach of the treatment plan of periodontitis. So same way, we endodontists also deal with a lot of treatment modalities. So that's why the European Society of Endodontology took an initiative to do a similar project like this. So as we know, in endodontics, you have a lot of controversies, example for pulpotomy, or pulpectomy, or regenerative endodontics. So that we formed a team across around 20 to 25 members across the globe, and we are planning to start this project. So this project is led by Hal Duncan, and me, Iklas, and Paul Damar is helping him out. So in this project, what are we doing is, we are totally selecting around 12 to 15 systematic reviews for each aspect, like what is the clinical practical guidelines for pulpotomy, pulpectomy, autotransplantation, or revascularization. So based upon that, each systematic review, you will be getting one particular guidelines. Why am I saying this is, that's why the systematic review quality has to be a little bit higher. So coming to the quality of systematic reviews, you have two different aspects. One is methodological quality and reporting quality. So what is the difference between these two is, methodological quality will explain you how to conduct your systematic review. Reporting quality will explain you how to write a manuscript or what are all the points to be reported in the systematic review. So the first is Amster tool. Yesterday I got couple of queries in the chat section which we missed because of the lack of time. So they asked us, can you tell something about Amster tool and tell something about umbrella review? So main methodological quality will be focused on this Amster tool. So totally this tool, what does it mean is, it helps you how to conduct your systematic process. It will help you in conducting your systematic review. So totally they have around 16 items in this. So how to go is, in Google you type Amster systematic review. So automatically they will be having this particular website. So in this website, if you click this checklist page, so automatically that 16 items will be listing it down. So for each item, you have to score. For example, first item is based on your research question. So for research question, you have to click whether you have population, intervention, comparison, and outcome. Then finally, you have to score this yes. Same way for the next item also, you have to score whether it's yes, partial yes, or no. So finally, you will have the 16 questions. So at the end of 16 question, you will have something called calculate. So if you click this calculate, automatically it will come saying that whether is your review is high quality, moderate, or low quality. So this is how the Amster tool works. So please read this particular website and make sure what is important, and you have to reflect that in your systematic review process. Next is reporting quality. As Nivedita ma'am told you yesterday, so recently this Prisma has been updated. So they have released this Prisma 2022 checklist. So this will help you in reporting quality. So that's why most of the journals, you have to submit this reporting quality checklist. It means once you completed your manuscript, you have to download the form from the Prisma checklist website. Then you have to tick it up and mention which page that item is reflecting. For example, one of the item is research question. So you have to make a note saying that page 2, the research question is reflecting, so that a reviewer will have a look on that. So that is why this plays a key role, and it will help you in drafting the manuscript as well. So the next is, this is one of my study which I published with OA Peters. So what we did is we randomly picked up couple of systematic reviews and meta-analysis which is published related to endodontics, irrespective of 5 journals. So what we did is we appraised against this Amster and Prisma tool. So for overall, we have given a score. So whenever you have time, please read this paper so that you will know what is missing in systematic reviews which is published in endodontics. For example, if you see this Amster, this, for example, scientific quality of studies used in conclusion has almost only 20 to 30%. It means only 20 to 30% of review has addressed this particular item. So this is one of the items. So this is the one of the reason for manuscript is getting rejected. So all those details I'll be explaining in my next couple of my slides at particular sections. So the next difficult point is when we have to select systematic review and when it has to be a narrative review. So most of us are in assumption saying that if it has to go for publication, it has to be a systematic review. No, it not depends on individual person or individual journal. It depends upon your individual topic. See, even most of the top journals are accepting the literature narrative review. For example, if you see this first, it's about AI in dentistry, which is published in JDR in 2021. The next about external cervical resorption. As we all know, there are a lot of reviews published about cervical resorption, but still a narrative review has been published in 2021. Same way, if you see this last part, we worked on outcome of surgical extrusion, intentional reimplantation, and tooth replantation is basically a narrative review. So even narrative review will be accepted by all the journals. How to decide whether it has to be a narrative or systematic review is based on your lot of heterogeneity in your systematic review or narrative review topic. For example, this is one of my recent topic which is published in Journal of Endodontics. It's a narrative review. The topic is artificial intelligence in endodontics, which I wrote with my American friends. So initially we had a discussion, me and Anita had a discussion, why it can't be a systematic review. But what we thought is, this is number one, is a very broad topic. So I have to compile all these studies in endodontics. For example, there will be a studies related to detection of vertical root fracture, detection of periapical pathology, detection of working length determination. So I have a lot of steps within this endodontics. Plus, in one particular field, for example, periapical pathology also, I have a lot of various in methodology. For example, few studies did with intraoral periapical radiographs. Few did with OPG and few did with CBCT. So I can't combine all these things under the umbrella of systematic review. So that's why we kept this title as very broad, and that's why this topic we have selected as narrative review. So hope you understood that. So to select your topic to be systematic review, it has to be very focused. So same topic, I can do a systematic review. For example, detecting use of artificial intelligence in detecting the periapical pathology by using CBCT means my research question is very focused. So that topic can go for systematic review. But unfortunately, in that topic, we don't have a lot of studies in endodontics. So that's why we piled up all the studies in used in endodontics. So that's why we took narrative review. So next, coming to the protocol. So why is this protocol is important? Yesterday also we had a discussion about this protocol. So this protocol helps you in improving the transparency, and it's like act as a roadmap for you to conduct your systematic review process. And it's not only for systematic review, even it's for clinical trial or whatever post study, your protocol is very important. So once you guys decided to do a systematic review, please draft a protocol. That protocol will help you in guiding for your literature search process. Plus, if you see these two papers, a lot of papers says that the protocol registration improves the quality of systematic reviews in both medical and dental. It's not only related to systematic review. Again, this is one of my study which is published in International Endodontic Journal. If you see this, we collected randomly few couple of clinical trials which is published related to endodontics irrespective of journal. So general journal like clinical oral investigation, CHEDIA, everything we included. Then we categorized one of the category is protocol registration. So we put that there is a positive association between protocol as well as for the quality of clinical trials. If you see that the trials which has been registered as almost 76% has quality is improved. So it means there is a positive association. So for that, how to write So for that, how to write your protocol is you have to use this particular paper. Again, it's developed by the Prisma group. This protocol or this checklist is exclusively for how to draft your protocol. You have almost close to 20 parameters. Take that checklist and it will help you in writing your protocol, especially they have guided you right from how to write your title and all those information. So it will be helping you up. So that's why, due to this importance of protocol, whatever I said, most of the journals, especially in medical field, for example, Lancet, PLOS One, JAMA, and British Medical, have said that mandatory prospective registration for trials as systematic reviews. So we and with this type of journals, recently this International Endodontic Journal also has endorsed this rule, saying that we need a mandatory prospective registration for clinical trial and systematic reviews. This we wrote an editorial now. It in press, so shortly within another 2 to 3 months time, it will be in it will be in print. So what we said in this editorial is, if you see this red box, this International Endodontic Journal requests author to provide the name of the registry with registration number in the abstract and materials and methods section within the manuscript. Any changes or deviation to the protocol must also be recorded on the registry and reported in the manuscript along with a clear and logical justification. So what we have to do is, as an author, already in most of the journals, especially in International Endodontic Journal, if you see that the author guidelines for abstract of systematic review, you will have this column saying that for registration as well as for funding. So you have to key in those information. And then in materials and method also you have to enter what database and your registration number. After creating this rule, I can hear few mind voices from this participant saying that already International Endodontic Journal is very difficult to enter. Plus, you guys are creating a lot of rules and regulations. So that's why we wrote this next 3 lines. The main aim of this endorsement is not to overburden the researchers, but to reduce bias and increase the accuracy, transparency, and accountability and integrity of publication. So that's why we also introduced this protocol as a mandatory for International Endodontic Journal. So the next question is, what database can we include? So most of the systematic reviews can be registered in Prospero, or few of them are doing in vitro studies systematic review. So for them, this is one of the platform you can register your systematic review based on your laboratory based studies. Plus, no journal is not focusing or saying that this particular database has to be recommended. They are not recommending any one particular database. You can do it any databases, but preferably this two is little bit better. That's all. So the next is how to write your title. So the very important in a manuscript is two things. One is title and abstract. So because as a reviewer, if some journal is sending to the reviewer, they will be sending only the title and abstract. So please focus, give a little bit. So how to write your title is, you have to focus, it has to be give a clear picture about your aim or research question. It has to cover as much as your PICOS, that is your research question, and you have to give a clear picture whether it is a meta-analysis or network meta-analysis or whatever study you are doing it up. So if you see this title, for example, efficacy of biodentin and MTA in primary molar pulpotomy. So here I have included my intervention, that is biodentin, comparing it with MTA. So my outcome is primary molar efficacy, and my population is only focusing on primary molar pulpotomy. So it means I am least bothered about the permanent teeth, and I'm least bothered about primary premolar teeth. Sorry, primary your other tooth, your anterior and all those things. So your title has to be very clear. Plus, I am focusing here is meta-analysis coupled with trial sequential analysis. Plus my study design is I'm focusing only on my randomized clinical trial. So if you see this title, so it will automatically reflect your research question and inclusion and exclusion criteria. But again, the next question is, what about the word limit? In case if you have a word limit, accordingly you can tell it. So if I have a word limit in this title, I will be reducing my randomized clinical trial. So the next, if still I have to reduce some other more words, I'll be cutting it up with trial sequential analysis. I think most of the journal is giving about 30 to 35 or 40 words, which we can easily fit all those criterias. So next, as you see, for example, the next will be my one of example is a systematic review and network meta-analysis. So the reviewer will be clearly knowing that the whole study will be focusing on network meta-analysis, and authors have included only randomized clinical trial. So what does it mean? So the quality of my evidence will be little bit more. So this is the first impression which you are giving for the reviewers. Same way, if you see this one of the study, we have clearly mentioned an umbrella review. So it means we are planning to do only an umbrella review. So only the systematic reviews will be included in this particular article. Next is coming to the abstract. As I told you before, abstract also is very important, and please remember it has to be a standalone. So just because you're putting it in your materials and method and discussion, it doesn't mean that you have to cut short your abstract. So that's why Prisma Group has exclusively released this paper for Prisma for abstract. It means again you have a particular checklist how to draft an abstract for systematic review. So as Nivedita ma'am showed it to you yesterday, these are all the 12 parameters which you guys have to capture. But in these 12 items, I can see most of the items is captured, but except this point through eligibility criteria. You have to give a brief inclusion and exclusion criteria in your method section, so that the reviewer or authors or readers, it will be helpful for them to understand, okay, these are all the points they have included. So same way, the next point missing is your limitations of your evidence. It means the limitation of your study also has to be explained. Generally in discussion section, what they do is, for example, they are comparing A versus B. A is better is your result. Discussion, they used to say A is better for treating the root canal treatment. That's all. That is not enough. You have to explain what is the limitation. For example, the risk of bias has been done and it has been got the low quality, and all those things has to be explained so that it will be helpful for the authors to interpret. So this point you have to capture it more. Limitation of your study. The next is, as I told you before, you have to enter your funding and registration details as well. So again, so for the benefit of the beginners, we wrote this paper and published in International Endodontic Journal exclusively for Prisma for Abstract, best practice for reporting abstract of systematic reviews in endodontology. So what we did is, we have explained about this each 12 points in simple words like this. For example, this is the item 4 about the databases and search date. We have explained in this section, and we have given examples related to endodontics so that it will be easy for the readers to appreciate and understand the importance of each item, so that they can be used and apply while they are drafting their abstract section. Next is how to draft your introduction section. See, introduction has to be mainly focused on strong rationale and justification. This is your selling point of your systematic review. So any referee or any editorial board member has very interested in this particular point. So for example, this is one of my review which we published in IEJ. We studied what is the effectiveness of technology enhanced learning in endodontics. So introduction, don't write only about the technology enhanced learning, that everybody used to know about that, but we have to write why is this important and why it has to be a systematic review. So if you see that introduction section, we wrote one paragraph exclusively on rational. Previous paragraphs we wrote about what is the different type of endodontic education system and what is the importance of technology enhanced learning in medical and dental. Then already a systematic review has been published in 2020 for endodontics. So we mentioned saying that this review has been published, but after since 2010, there are several advanced method has been introduced in endodontics, like your voice over screen or hepatic virtual reality and VACAD and lot of methods. So henceforth, it is timely to re-evaluate the effectiveness of technology enhanced learning. So that if you read this particular paragraph, we will understand saying that some review has been published in 2010, but after 2010, there are a lot of new methods has been introduced, so it's time to re-evaluate. So that is why the need arises to update the previous review. So this will be your rationale. So please try to give importance for rationale and justification. So this paragraph is very important rather than this previous two paragraphs which we wrote in our manuscript. Same way, one of my example is we wrote a paper on what is the association between apical periodontitis and adverse pregnancy outcome. So generally what we used to do is we write one paragraph about apical periodontitis and one paragraph about the pregnancy outcome and its relation, but we have to link it up from systematic review aspect, why it has to be done. See, for example, we wrote few lines about various other medical condition and apical periodontitis. For example, diabetes, there is an association, so we have wrote about that. Same way we want to know about the pregnancy outcome. So in the current existing literature, it appears inconsistent. It means in existing literature, there are a lot of controversies between this apical periodontitis and pregnancy outcome. So then the reviewer will think that, okay, it's the gap in your existing literature is, there are a lot of controversies, so we have to draw a line. So that line is your systematic review. So the next is how to write your methods. So methods, you have to make these headings very clear. Literature search process, whatever which Nivedita ma'am updated you yesterday. Same way risk of bias, what Welsa told you yesterday. Meta-analysis, you have to give clear thing what Dr. Srini told, then publication bias and what is additional analysis and what is grade. So I'll be explaining it to you in bit detail about grade in next couple of my slides. So you have to focus these 5 points. How many persons involved in each process? For example, your literature search or including exclusion criteria, your risk of bias assessment, plus your detailed methodology has to be explained, for even if it's a meta-analysis or risk of bias. Coming to the risk of bias, everybody is doing that process nowadays, but they are writing in one line saying that the risk of bias in this current review has been used Cochrane tool. That's all. That one line is not enough. You have to explain how many persons involved in risk of bias assessment, what are all the criteria you are planning to include in your Cochrane, your tool. Then you have to use about, you mention about your software. For example, if you're doing your meta-analysis, what software are you using? So you have to give details about that. Plus, in case if you're doing some scoring criteria, which yesterday Wells told you, you have to explain that scoring criteria in detail. For example, if I'm getting this, I'll be scoring 1. If not 0 or not 0.5, then finally, how are you going to pull it up? For example, if it's I'm getting my percentage is 0 to 30 is low quality or high quality, you have to explain that. Plus, the most important is you have to justify or support with your reference. Next is, yesterday we had a chat regarding that how the reviewers will check about the number of papers which is available in the database. So if you see this first, this is one of the comment which I got from one of my paper. The reference 36 and reference 29 are not listed among the 3 databases authors cited as having been used for this systematic review. From where did they obtain these studies? So what does this question mean? So the reviewer has used my search strategy and he searched in 3 databases, whatever which I told in this manuscript, and he found that I have included these 2 studies, but these 2 studies is not available in these 3 databases. So he is asking me from where I got these 2 papers. So what does it mean? So reviewer has extensively worked. So this is the role of a reviewer. So he will be checking in and out of your paper. So there is no doubt about it. So you have to be very clear about all those information. So then we justified saying that we obtained the 2 references from the reference list of published systematic reviews. We have already included this statement, the reference list of published systematic reviews in methodology section under the search strategy and study selection. It means we have already mentioned a statement saying that we have checked the reference list of previously published systematic review. So from that review, we captured this to study. Then the reviewer got said okay for this comment. The next is, few reviewers are very critical. They are asking one of the question which you can see it below. Authors of the studies were contacted for any missing information. In how many cases did it happen? So they are asking us, they are checking the genuinity of my words, saying that how many times I have contacted the missing authors. Then we have replied saying that so and so we have a doubt and we have contacted one particular author and no other missing data are we found, so that we never contacted much. So the next is, this is one of my review paper which we did it on lab-based studies. So we compared the shaping and outcomes, shaping properties and outcomes between the rotary and reciprocation. In this study, we have modified the risk of bias. So if you see this highlighted line, we have clearly said we have modified the revised Cochrane tool. I have given my references and adapted to the nature of in vitro studies. So what are all the parameters? These are all the parameters I have assessed. So I have included standardization of root canal anatomy and operator variability, and I have removed 2 items also. So all those things I have to explain in my discussion section, so that I am justifying why I have modified a particular tool. So the coming to the next is grade. This also is very important, which you have to explain your methodology section. So what is grade is, you have to grade your quality of evidence which you are getting it from your meta-analysis and your risk of bias. So this is your measuring tool, where how is your result of systematic review. So how to go this is, you have to type in your Google is a Grade Pro software. So automatically this page will be opened. So once you open this, you will be having a page exclusively for what are all the publication which you have to read. In that you can see this grade handbook. So you have to read this grade handbook. If you click this go to handbook, so automatically a free book will be opening it up. So please read that. It will give you clear instructions and few informations about this grade. So grade means it's grading of recommendation, assessment, development and evaluation. It means it will assess the quality of your systematic review based on few parameters. So here also you have to create an account. Once you create an account, you will be getting in this particular page. So these are all the previous reviews or previous studies which I did with this software. So here you can see your right hand side, you can see the new project. Once you click this new project, so automatically this page will be opened. So this table you have to represent in your manuscript, either inside your manuscript or supplementary, is up to you. So these are all the headings with dark blue color which you have to capture. So the certainty, can you see this 4 plus high? So this is very important. It means my quality of evidence is high. Sometimes it can be low or moderate. So it depends upon all those parameters. So the first is number of studies, means what are all the studies which you have included in your review you have to enter. For example, this is an example chart, okay? I have typed 5 here. Next is study design. So I have included only randomized trial. So the next is these 4 parameters depends about risk of bias, inconsistency, indirectness and imprecision. These 4 is the key items in this particular grade. I'll be telling you in next slide what about these 4 points. Next is number of patients. Number of patients for randomly, for example, I have given as ABC is one group, another one group is DEF. So you have to click what is the number of success and overall. It means I have included totally 10 samples. In the 10 samples, 5 is my success. Same way here, 10 samples, 2 is success. This relative value you have to take it from your meta-analysis. The last column of meta-analysis, you will be having your risk ratio value plus this is your confidence interval value. So this will be automatically calculated by the software, and again this will be automatically given by the software. So I'm repeating this, from here to here you have to fill. So once it has been done, so automatically the system or software will give you the quality of evidence. Next is this 4 parameter risk of bias. Once you click this dark blue risk of bias, so automatically this 3 option will be opened. So once you open, you have already done your risk of bias tool using your Cochrane tool. So Cochrane or whatever. So you can select whether it's serious or not serious or very serious. Again, coming to your inconsistency. Inconsistency is mainly based about your unexplained heterogeneity. As Dr. Srini told about details about heterogeneity, so you can see in your meta-analysis your forest plot. So for example, if your I-square is less than 40%, it will be low. It's 30 to 60%, it is moderate, and 50 to 90% substantial, and 75 to 100%, it may be considered as considerable. If you see this scoring criteria, few scores are getting overlapped. For example, if your score is 55, it will be comes under moderate, as well as substantial, correct? So why they have given this, they are given is an arbitrary score. As a content expert, you can score whether it can be a moderate or substantial. So coming to the next is your indirectness. Indirectness is mainly for direct evidence or indirect evidence. So coming to the meta-analysis, it means mostly we are including our direct evidence. It mainly depends on your applicability and generalizability based on your population, intervention, outcome. For example, in this example I told you, 5 randomized clinical trial has been included. It is a 5 clinical trial, all the trial has been conducted only in Australia, for example. So what does it mean? It can't be applicability and generalizability is not proper. So it means if the same 5 clinical trials run in 5 different populations, one is UK, US, India, Iran, and Australia, then you can say the generalizability will be better. Same way about your intervention. Same intervention, for example, you want to compare 1.8 and 3.2. In all the studies, if they used 1.8, then you are very precise. So you can keep it to the good standard. So this is how you have to measure your indirectness. The last is your imprecision. Imprecision means it mainly depends on how about precise your value is. It depends on mainly 2 items which you can capture. One is about your confidence interval. As Dr. Srini spoke in previous lecture, in a meta-analysis, you will be getting one risk ratio or odds ratio, followed by within the brackets, you can see the confidence interval. For example, it will be 1.2 to 1.5. It means your confidence interval is very narrow. So it's a good quality. For example, if it can be like a 1.1 to 10.1, for example, it means it has wide confidence interval. So according to that, you have to downgrade your grade. The next point to capture your imprecision is your optimal information size, means the total number of samples which you have included for meta-analysis. So for that, you have to do your trial sequential analysis. So the trial sequential analysis will show you whether the sample is enough or not, whether it will show you whether it is conclusive or inconclusive. If it's conclusive, you can improve your quality of your grade. In case if it's not conclusive and sample is very less, so automatically you have to downgrade your quality of evidence. So based on this, you have to score this. Again, this is the sample of the chart. See, I have 2 outcomes. This is number 1 and this is number 2. So based on these 2 things, I have to click all those informations, and finally I got moderate and moderate. There are few studies for 2 outcome. You will be getting one as moderate and another one is low. It's nothing to worry. You just project just whatever you got. Plus here you have to mention how do you justify it. For example, here I have mentioned it's serious. So I have mentioned reason is among 2 studies, one study was high risk of bias. So it means 50% of my study is high risk of bias. The quality is low. So that's why I have entered as serious. If all these studies are good quality, I will mention not serious. Same way here, imprecision, it's B here. It means the optimal information size criteria is not met. See from the figure 4, the figure 4 will be a trial sequential analysis image. So it means that this particular trial sequential analysis says that the number of sample is less. So that's why I have downgraded it to serious, whereas here it's not serious. Coming to the next is how to write your result section. So result section, again, it has to be categorized in clearly in following headings: literature search process, how many papers you got, how many included, how many excluded. In case if you are excluded after your full text retrieval, you have to give the reasons, plus you have to provide your reference as well for that. Next is important characteristics, means what is the key findings alone you can mention in your text, rest everything you can capture in your table. It doesn't mean that you have to include all the information in your result section. Next is your ROB. You have to clearly explain what is the criteria and what is the results you obtained, and same way for meta-analysis, sensitivity and group analysis, as well as for your grade and your publication bias and everything. The next is discussion section. So again, this is one of the most important here is how to draft your discussion section. The first paragraph, you have to write your results. Results in sense, don't write exactly whatever you got the results. For example, I'm comparing two drugs, A versus B. B is better. You have to explain why B is better. So this is the first you have to explain. Next is, in case if meta-analysis is not performed, you have to explain why it has not been performed, so that the reviewer will know that the authors are aimed to perform meta-analysis, but due to so many reasons they can't perform. So this is very important. Next is your quality assessment. This is extensively missing in most of the papers which we are getting rejected is they are doing their quality assessment, they are mentioning the methods and result, but there is no absolutely the details are missing in the discussion section. So authors have to discuss in detail about what are all the parameters, why they have scored and why they got the result. The same way like the meta-analysis results also they have to discuss, plus any modification they have to explain why it has to be modified, it has to be justified with the reference. Next is about your grade. In grade, you will be discussing about your risk of bias, your imprecision, your inconsistency and everything. Next is you have to write in detail about your heterogeneity. If you don't have heterogeneity as well, for example, as Dr. Sini said, few systematic reviews you will be getting 0%, but still you mentioned saying that there is no heterogeneity for meta-analysis. In case if you have meta-analysis, you have to explore what is the reason for meta-analysis. So according to that, you will be performing your additional analysis, whether it is a subgroup or sensitivity or whatever. Then this is one of the very important and missing in most of the systematic reviews. You have to give your justification for included studies. For example, you are including only randomized clinical trial. You have to explain why it has to be included. Then, for example, if you are included in only in vitro studies, you have to explain why you have included that. So that is also very important. The next is strength. You have to say what is the strength in your review process and your result. You have to explain that. Next, very important is limitations. So what is the limitations? So that plays a key role in a systematic review, so that the future reviewer or future person can take it up in that. The next is future directions. So what are you recommending to the readers for both clinical practice as well as for your researcher? For example, if you are doing A drug and B drug, you can explain the B drug is better so that it can be helpful for clinical practice. Same way, the lacunae in this review is so and so. So we recommend for the future clinical trialist can do it up. So these are all the points which you have to capture in the discussion section. Next is, for example, the quality of studies, as I told you before. This is one of the study which we have modified the Cochrane tool. So if you see that, we have extensively said that these are all the parameters which is not applicable. For example, bias as a result of missing outcome is not applicable for in vitro studies. As we all know, this will more applicable for clinical studies. So missing the outcome, the dropouts will be more. Whereas for the laboratory studies, this criteria is absolutely not necessary. So that's why we knocked out that particular parameter, and we have brought in another two parameters. So you need to write an exclusively one paragraph saying that why you modified the tool, and you have to justify that. Next is, this is one of the important item in Amster, which I told you before, is how to conduct the systematic review. Did the review authors provide a satisfactory explanation for and discussion of any heterogeneity? It means you have to discuss about your heterogeneity in detail. Next is selection of the study design. As I told you, for example, if you are including only laboratory-based studies, or you combining both case reports and observational studies, you have to give justification for that, why you have included both studies or any one particular studies. The next is, the last part is the conclusion. So conclusion, you have to interpret both the things, results of your meta-analysis as well as your results of your risk of bias assessment. As I told you in my first couple of my slide, in that methodological reporting quality of my paper, I said you the studies which used the conclusion relating to the risk of bias assessment is very less in endodontics. So it means you have to bring your results of risk of bias assessment. If you see this, one of the title, we have compared efficacy of various anesthesia techniques for irreversible pulpitis. My conclusion is your Gaugues and MI showed similar anesthetic success rate for so and so. So this is my results of meta-analysis. Then if used as an anesthetic techniques on their own, success rate for each of the three techniques is a concern indicating the need for supplemental anesthesia. This is the take-home message for the clinician. So even though if you're giving a single block, sometimes or most of the times you need a supplemental anesthesia. This 2 point is basically about the results of my meta-analysis. If you see these last 3 lines, the quality of evidence was rated as moderate for Gaugues and your inferior alveolar nerve block compared with low quality for MI and inferior alveolar nerve block. As I told you, one of the anesthesia technique I got moderate quality, another one called technique we got low quality. So based on this evidence, it will be helpful for the practitioners to take it up. So again, this is one more example. Here we compared formocresol and ferric sulfate for pulpotomy. So how we concluded is last 4 lines. First few lines it has been mentioned about the results of meta-analysis and TSA. Then we have given about what is the future studies. Then overall formocresol and ferric sulfate shows comparable clinical and radiographic success rate. Here we used 2 outcomes, so that's why we have mentioned clinical and radiograph. The results of meta-analysis is comparable, it means equal as a pulpotomy medicament in pulpotomy molars at all time intervals based on low and moderate quality. So it means the quality of evidence is low and moderate. If you see this last 2 line, it clearly shows that still we need some clinical trials which needs high quality. So that is one of the take home message. So that's why we are recommending that both your results of your meta-analysis and risk of bias assessment has to be into your conclusion. The next most common doubts which most of them ask me while how to conduct the literature process is these following questions. Systematic reviews can be conducted with laboratory-based studies. Yes, of course you can conduct your systematic reviews based on your lab or in vitro studies, but please remember the quality of evidence will be little bit lesser. Next is protocol registration can be registered only in Prospero? No. You can register in any database according to your convenience. The only thing is you have to give your name of your database as well as your registration number. Next is how many database has to be used. According to the Amster and Prisma, they recommend 2 databases, minimum 2 databases, but maximum is up to you. Preferably if it's 3 or 4, it will be good because we don't miss any papers. Again, what database is up to you. Any database which is good enough, you can use it up. Please don't bring Google Scholar as one of your main database. As you know, the Google Scholar will pick it up free gray literature as well. So that's a different entity. So how many person has to be involved in title screening, your abstract and full text? You need minimum 2%. Please follow this. This is one of the guidelines which was recommended by Amster and Prisma. So 2 independently persons has to screen that. Next is risk of bias is mandatory? Yes. Most of the systematic review, 99%, it's mandatory. Next is meta-analysis is possible for all the review? No. It's not possible. As a content expert, you have to take a call based on your heterogeneity whether meta-analysis is possible or not. In case if it's not possible, please give justification why it's not possible. Next is what software to be used for meta-analysis. Again, it's up to you. You can use any software like Cochrane, your Stata, or whatever software is easy for you. You can do it up. It's not an issue. Next is what are all the key papers which we have to read before starting the systematic review and meta-analysis. Number one is your Amster 2 paper, which has been recently published. This helps you gives you the clear idea about how to conduct the systematic review. The next is your Prisma 2020 statement, which helps you to how to report the items in your manuscript. Next is this particular editorial, which was written by me, Hall, and Paul Dummer, which is published in International Endodontics Journal. If you read this paper, can you see this highlighted red color? The aim of this editorial is to highlight several key issues for authors to consider while conducting and reporting the systematic reviews in endodontics. We have teased out few issues here. What are all the main lacunae which we found out? So we have highlighted those issues so that it will be helpful for you. Next is, as I showed you before, this paper is mainly exclusively be wrote only for abstracts of systematic reviews. So as I told you, we have explained about each item and we have given the explanation and rationale for that each item, and we have picked up few important examples so that it can easily you guys can understand. Next is for the benefit of the beginners. Again, we wrote this paper about glossaries for systematic reviews and meta-analysis. So in this paper, we picked up almost close to 70 to 75 terminologies, which is the most important terminologies which you have to understand that before starting the systematic review process. For example, if you see this 42 item, we have mentioned Prisma P, it means Prisma protocol. So we have explained in simple terms what does it mean. Same way if you see Prospero protocol, so that this paper will give you a basic idea. Plus we have given references also for each item, so that if you want to know in detail, you can go in detail about that particular paper. Next is about this particular paper is one of the most, two guys are working extensively a lot about the publication bias. If you want to know more about, please read this particular paper about this publication bias. And this is the grade handbook. As I told you before, you just go into that grade website, click go to handbook, so automatically this particular book will be open. So please read this before going in for grade approach. So again, to summarize, once you guys decided to do a systematic review, this is the process which you have to follow while conducting a systematic review. Once you selected the topic, please search in your PubMed and Prospero. For PubMed, why I'm saying you is, it's a most common database, so it will give you any previous systematic reviews has been published in your topic of interest. Same way, search in Prospero also, to knowing that anybody has already registered the protocol in Prospero. In case if they are registered, please have a look on that, so it will automatically guide you that. In case you want to update that review a little bit different, again you can register in Prospero, but only thing is they will be asking you in what way your review is better than that previous registered review. So you have to give few justification in what way it's different, that's all. The next is creating a team with individual responsibility. As the last three speakers, Nivedita ma'am, Vail sir, and Dr. Srini told you that systematic review is absolutely a team effort. So as a lead author or as the senior most person, you have to create a team with individual roles. Who is going to do what? For example, who is going to do a literature search process? 2 persons. Data extraction, risk of bias, and who is going to be the third reviewer who is going to tease out your discrepancies or disagreements between these 2 reviewers. Once your role is fixed, you have to draft your protocol. Once your draft is okay, then you can register in any database. Then you can start your review process. Once your review process is done, then you can start with your manuscript preparation. Once your manuscript preparation is done and read by all the authors, the next most important step is the senior most author in that group has to do this particular job, that is manuscript appraisal. He has to think himself as a reviewer or an associate editor or an editor in chief for any journal. So he has to read that paper in asking, questioning mind. So he has to put a lot of questions in that paper. He has to tease it out. So that is the main role of the senior author in that particular paper. So then once he developed a lot of queries in that particular paper, again it has to be addressed by the whole team. Again that senior member is happy. Again finally you can go for submission process. So if you follow this protocol, I'm sure you will be having success in your systematic review process. So the next is coming to the last is the take home message from my presentation is I have highlighted what is the importance of quality, that is your methodological and reporting quality, and how you have to select your topic, whether it has to be a systematic review or narrative review based on your topic broadness. If it's very broad, please go only for your narrative review, don't go for systematic review until and unless your topic has to be very focused. Then how to draft your title. As I told you, it has to be more or less reflecting your research question. Abstract, the most 2 point which is missing is inclusion and exclusion criteria, and add your limitations, and please add your results and your conclusion. Please add your results of your risk of bias assessment or grade. Introduction, the very important is your rationale. Methods, you have to give very detailed about your methodology, your software, how many persons involved. Importantly, you have to back it up with your reference. Next is results. As I told you, you have to give results for all the aspect. Next is you have to discuss your results of meta-analysis, your risk of bias assessment as well. Risk of bias assessment means don't give only your results in your discussion. You have to mention why it has been done, why it has been downgraded, why you have been improved the risk of bias. Everything you have to discuss right from your publication bias, your grade, your heterogeneity, what is the reason for including your particular study design. Next is conclusion. As I told you, you have to combine both the results of meta-analysis as well as your results of risk of bias assessment. So the most common reason for your systematic review for rejection is the two things. That is rational, it has to be very strong, and it has to be explicitly mentioned in your manuscript, in your introduction section. Next is your how well you are presenting it in your manuscript. That is mainly depends on your reporting skills. So once you read and make your knowledge very clear about your Amster and Prisma, you won't miss all those points. Next is, as I know, the systematic review is very difficult, but it's not impossible. So please never say never. I would like to conclude this as my last slide from one of my favorite movie, Karate Kid. So please never say never. You can have a success in systematic review easily. Following, you have to be clear about your process, how you have to go about it. Next is finally, I would like to thank the SRM team, Mahalakshmi ma'am, Rajkumar sir, Saravanan and Kirtika for this opportunity, and my special thanks to Mahalakshmi ma'am for inviting me for this particular gesture and asking me to share my knowledge on this platform. And I would like to thank my friends across the globe who helped me a lot and collaborating with me in most of my publications. And I would finally thank the two great personalities who taught me many things in endodontics. I think these two persons no need any introduction on this floor. One person is Prof. Candy sir, is my teacher in my master's, and I did my PhD and I worked under him. Next is Prof. Paul Dummer. As you all know, he is the editor-in-chief and president for ESC Society, who taught me many things in endodontics. I would like to thank these two great personalities. And if you have any doubts regarding the systematic review and meta-analysis, you can connect directly to my mail ID. So my mail ID is easy to remember. So as you know, my name is Venkatesh Babu. You can say hi to me through my mail ID, hi.venkateshbabu@yahoo.com. And finally, I would like to thank you all for patient listening. Thank you.
Thank you, Babu, for a wonderful lecture and very patiently explaining each step very clearly. And thanks for your explanation about the significance of narrative review compared to the systematic review. Maybe and insight into the Prisma and Amster. Actually, it will give a lot of ideas for the beginners to write about the systematic review. Writing a systematic review is always a nightmare for many people like me. So it is like, you're given a lot of inputs and confidence for us to write about systematic review. And in this juncture, I would like to thank you for this wonderful lecture, and we are feeling very proud to see a lot of articles published in the reputed international journals under your name. And we used to refer a lot of articles with other foreign authors' names. Now we are able to see your name. It's a proud moment for you and for all of us. Right? And I thank you for a wonderful lecture. And a lot of questions are waiting for you. Over to Mahalakshmi Madam for the next session. Thank you, ma'am.
Thank you, sir, for the brainstorming session. Now, I request Dr. Rajshekhar, sir, to felicitate our speaker, Dr. Venkatesh Babu, sir, with the certificate of appreciation.
Thank you, Dr. Venkatesh Babu, for the wonderful lecture. Okay.
I thought you would give me something else, sir, other than
Sure, we'll say. Once you come to India, we will definitely we'll take care. Okay.
Thank you, sir. Now I request our HOD ma'am to felicitate our moderator, Dr. Rajshekhar, sir.
Thank you so much, Dr. Rajshekhar, for moderating and subject birthday. So here's video, very happy birthday, and from our side, certificate for you. So probably we'll put happy birthday on the certificate and give you.
Thank you, ma'am. Thanks a lot.
Thank you very much.
A different birthday for me.
Yes.
Thank you, sir. Thank you, ma'am.